Every morning, countless seniors begin their day by reaching for a bowl of sugary cereal or slices of white bread. This breakfast choice feels familiar, quick, and harmless, leading many to believe it causes no harm at all. What they don't realize is that these everyday foods quietly set off a dangerous chain reaction inside their bodies. Sugary cereals and white bread cause rapid spikes in blood sugar levels that happen within just 15 minutes of consumption. These sudden increases trigger an inflammatory response in the arteries, which over time begins to weaken the delicate lining of the blood vessels. The inflammation is silent, often producing no noticeable symptoms, but beneath the surface, it is insidiously damaging the arterial walls. This process is comparable to tiny gnaws that gradually erode the integrity of the arteries, making them more vulnerable with each passing day. As weeks and months go by, these inflamed areas develop tiny tears or abrasions in the arterial lining. These microscopic injuries are invisible without specialized testing but create an ideal environment for fatty deposits to adhere and accumulate. Over time, layers of cholesterol, dead cells, and fat molecules cling to the damaged sites, forming plaques that gradually narrow the blood vessels. The narrowing becomes more severe as these deposits grow thicker and more unstable. These plaques are not just static obstructions. They are fragile structures that can become unstable with even slight additional stress. The blood flow is hampered as the arteries become less elastic and more hardened, yet the seniors often feel no warning signs of this dangerous process happening inside their bodies. Unbeknownst to them, the risk is building deep within. The unstable plaques can suddenly rupture without any prior symptoms. When they rupture, they release debris into the bloodstream, which then triggers the formation of a small clot at the rupture site. This clot begins to rapidly grow, acting like a plug that completely blocks the artery. This process can happen swiftly, in less than 15 minutes, and often without warning. The blockage prevents vital blood flow to the heart or brain, leading to a life-threatening event such as a heart attack or stroke. This sudden rupture and clot formation often catch seniors unprepared, as they remain unaware of the growing danger until disaster strikes abruptly. The tragic part is that many of these ruptures occur without any pain or warning signals, making early detection nearly impossible. The damage inside the arteries might have been silently progressing for months or even years, all while the individual felt perfectly fine. One quiet morning in the midst of an ordinary routine, a tiny, often unseen plaque within an artery suddenly ruptures. Unlike the larger, more noticeable blockages, this rupture can go completely unnoticed by the person experiencing it, because there are no immediate pain signals or warning sensations. The rupture releases a flood of debris and exposes the fragile arterial wall to the bloodstream, triggering an adrenaline-fueled response from the body. Almost instantaneously, platelets in the blood swarm to the rupture site, rapidly forming a blood clot that clings aggressively inside the artery. This clot acts as a rapidly growing plug, expanding swiftly as more blood components stick to it. Within just a few seconds to less than a minute, this clot can enlarge enough to almost completely seal off the artery, cutting off vital blood flow to essential organs such as the heart or brain. The speed at which this cascade occurs leaves virtually no chance for detection or intervention, transforming an otherwise silent rupture into a catastrophic event. As the clot enlarges, it creates a complete blockade that starves the downstream tissue of oxygen and nutrients. When the heart's arteries are involved, the consequence is a sudden and devastating heart attack. The heart muscle begins to die within minutes of oxygen deprivation, and unless emergency measures are taken immediately, this tissue death becomes permanent, irreversibly damaging the heart's ability to pump blood. If the brain's arteries are affected, a stroke occurs. The brain cells are deprived of oxygen as the blood supply halts, resulting in the death of neurons. The damage from a stroke can begin within seconds of the blockage, leading to lasting neurological deficits or death within hours if not prevented. The rate of collapse is staggering. Medical data shows that a critical artery can become almost entirely occluded in less than 15 minutes from the initial rupture, highlighting how crucial rapid response and prevention are. In many tragic cases, these tiny blood clots do not merely cause temporary obstructions that resolve on their own. Instead, they set off irreversible damage. In the case of the heart, death of cardiac tissue leads to heart failure or arrhythmias that can be fatal within days. When brain tissue dies due to oxygen loss, the patient often sustains permanent neurological impairment such as paralysis, speech difficulties, or severe cognitive decline. These catastrophic outcomes are often the result of silent, progressive damage built up over months or years, punctuated by that sudden, deadly event. The true danger lies in the fact that this process is almost invisible until it reaches a critical, irreparable stage. The damage inflicted by these blood clots can leave survivors with lifelong disabilities, confining them to wheelchairs or dependent on intensive medical care, and in many cases it results in death despite prompt hospital intervention. When a blood clot completely blocks an artery supplying vital organs, the consequences unfold with terrifying speed. The organ begins to shut down in a matter of moments, as oxygen-rich blood ceases to reach tissue cells that depend on that flow for survival. The heart muscle, deprived of oxygen, quickly starts to suffer irreversible damage. Within approximately 6 minutes, dead tissue begins to develop. If nothing intervenes, the damage spreads rapidly, triggering a fatal heart attack. For the brain, the timeline is even more critical. Neurons, deprived of oxygen, begin to die within as little as 3 minutes. As the blood flow halts, brain functions rapidly deteriorate, and the individual may slip into unconsciousness or coma. The body's vital systems falter, and with each passing second, the chance of saving the patient diminishes exponentially. Emergency care must arrive swiftly, but often, by the time they are in hospital, the critical damage is already done, leaving little hope for recovery. In many cases, this cascade occurs so quickly that doctors find it impossible to reverse the process or prevent death despite their best efforts. The stark reality is that once the blood flow is fully cut off, the window for intervention is painfully narrow, sometimes less than 10 minutes. This rapid progression underscores the desperation to prevent the event altogether, rather than attempting to treat it after the damage has begun. Hospital medical teams frequently discover that these life-threatening events are triggered long before symptoms appear. Routine blood tests, often overlooked or misinterpreted, can reveal the silent inflammatory processes already at work. Elevated levels of inflammatory markers such as C-reactive protein warn of ongoing arterial inflammation that has silently weakened vessel walls for months or even years. Studies have shown that in cases of abrupt cardiac or cerebral events, doctors often find that the initial plaque rupture and ensuing clot formation were brewing silently, unnoticed by the patient. The buildup of plaque, coupled with chronic inflammation, reaches a critical threshold where rupture becomes almost inevitable. Without warning signs or pain, the arteries become ticking time bombs, set to explode at any moment. Many lives are lost precisely because this dangerous phase passes unnoticed, remaining invisible in routine screenings until disaster strikes at the worst possible moment. These silent processes are insidious, intensifying over time until a small, unnoticed rupture triggers a catastrophic blockage. Recognition of this hidden danger highlights the importance of proactive prevention, emphasizing the need for approaches to reduce inflammation and plaque formation long before symptoms occur. The unifying solution lies in a simple, consistent dietary adjustment that can interrupt the lethal cascade before it starts. Reducing inflammatory foods and boosting nutrients with proven anti-inflammatory effects are key. Consuming foods rich in omega-3 fatty acids, such as 2 tablespoons of ground flaxseed or chia seeds daily, can help lower arterial inflammation levels. Incorporating antioxidant-rich berries like blueberries or strawberries at a serving size of half a cup each day can further combat oxidative stress that fuels inflammation. Switching to a breakfast of oatmeal prepared with rolled oats cooked with 250 milliliters of water at a gentle simmer for exactly 5 minutes, then topped with a quarter cup of mixed berries and a handful of walnuts, delivers a powerful dose of anti-inflammatory nutrients. Maintaining this routine consistently, especially in the morning when inflammation begins to spike within the first 15 minutes after eating, sets up a protective buffer against plaque buildup. It is vital to eliminate or drastically cut back on processed foods, added refined sugars, and trans fats, which all exacerbate inflammation and accelerate plaque formation. Hydrating with a glass of warm water infused with half a lemon every morning at exactly 6:30 a.m. can also support detoxification and reduce arterial stress. This combination of dietary measures can keep inflammation at bay, protect the arterial walls, and significantly reduce the risk of plaque rupture, helping to prevent the rapid progression toward organ shutdown and ultimately saving lives before devastating events materialize.